Unexplained weight loss refers to losing weight without changing your diet or exercise. This can be an early sign that your body isn't absorbing nutrients properly, often due to a malfunctioning pancreas. Strange belly pains are often vague, such as discomfort in the upper abdomen or radiating pain into the back. These aren't always sharp pains, but persistent and dull, which people tend to overlook. Changes in digestion might include bloating, nausea, frequent indigestion, oily or pale stools, or feeling full quickly. These are signs that the pancreas may not be releasing enough digestive enzymes. These symptoms often seem unrelated or harmless, but together, they can point to something serious. Stop scrolling. This is a powerful interruption cue. It forces the viewer to pay attention, creating a moment of tension and urgency. By saying stop scrolling, it acknowledges the viewer's behavior and breaks the passive consumption pattern, urging them to focus on what may be a life-saving message. These could be silent signs of one of the deadliest cancers, pancreatic cancer. This final line is the real punch. Silent signs means these symptoms don't always scream danger. Pancreatic cancer is infamous for showing no clear symptoms until it's in advanced stages. It reinforces the fact that pancreatic cancer is among the most lethal cancers, often due to late detection. Combining these vague symptoms with a strong warning creates an emotional pull, prompting viewers to reflect on their health and take action, such as watching the full video, consulting a doctor, or learning more. It creeps in quietly, and by the time symptoms appear, it's often advanced. But knowing the signs early can save a life, maybe even yours. Subscribe button and bell icon are platform-specific terms that clearly tell viewers what to do. The placement before the main content increases the chances of gaining subscribers while interest is fresh. So you never miss a health update, especially when it comes to disease-fighting diets and critical wellness alerts. This line gives value and motivation for subscribing. Never miss a health update reassures the viewer that staying subscribed keeps them informed and protected. Disease-fighting diets appeals to proactive viewers looking to prevent or manage illness through nutrition. Critical wellness alerts adds a sense of urgency. Viewers don't want to miss out on possibly life-saving information. Let's dive into the 7 shocking symptoms of pancreatic cancer that demand your attention. This is a powerful transition into the main content. The phrase "dive into" is energetic and engaging. 7 shocking symptoms builds intrigue. Viewers wonder what the symptoms are and if they're experiencing any of them. Demand your attention adds weight, emphasizing that ignoring these signs could be dangerous. Unexplained weight loss. This sentence sets the stage by identifying unexplained weight loss as a critical early symptom of pancreatic cancer. Sudden and unintended emphasize that this weight loss is not part of a planned diet, it happens without trying. Calling it a red flag signals danger, urging the viewer to take it seriously. By stating it's one of the earliest and most common, the script stresses that this symptom often appears before a diagnosis, making early recognition vital. Pancreatic cancer affects how your body breaks down food, causing fat and muscle loss even when you're eating normally. This sentence provides the biological explanation behind the weight loss. The pancreas plays a major role in digestion, producing enzymes that help break down fats and proteins. Cancer disrupts this function, meaning nutrients are not absorbed properly, even if calorie intake stays the same. This leads to muscle wasting and fat loss, which can result in rapid and dangerous weight reduction. If you're dropping pounds and don't know why, don't brush it off. This line is a direct warning to the viewer. It speaks plainly and personally. You're dropping pounds makes it relatable. The phrase "don't brush it off" is a gentle but firm push. It acknowledges that people often ignore symptoms or delay seeing a doctor. The tone is serious but caring, aiming to prompt action before the condition worsens. This sentence breaks assumptions. Many people experience stomach aches from gas, indigestion, or stress. But here, the viewer is told to pause and reconsider. This pain is different. The phrase "not your usual" triggers curiosity and concern. It sets up the viewer to understand this pain may indicate something dangerous happening deeper inside the body. Many patients describe a dull, persistent pain in the upper abdomen that moves to the back, especially when lying down. This is where specifics come in. Dull and persistent describe the pain's quality, not sharp, but constant, and potentially easy to ignore or misattribute. Upper abdomen that moves to the back gives a geographic clue. It helps viewers mentally map the symptom. The phrase "especially when lying down" is crucial. It provides a pattern that's common in pancreatic cancer and helps differentiate it from ordinary pain. It's caused by the tumor pressing on surrounding nerves or organs. Here's the why. This explains the source of the pain. As the tumor grows, it may invade or compress nearby nerves, especially those close to the spine or lower ribs. This internal pressure can make the pain feel like it's coming from the back, which confuses many people and delays diagnosis. If you feel this kind of pain regularly, get it checked. This is the call to action. Regularly is key. Occasional pain may not be alarming, but a pattern is a red flag. The tone is serious yet approachable. Get it checked is simple advice that could lead to early diagnosis and potentially save a life. This title grabs attention with a very visible, unsettling symptom: yellowing of the skin and eyes, and introduces it using a medical term, jaundice. It's a red flag that's hard to ignore, making it one of the more alarming and urgent signs. One of the more visible signs is jaundice, which happens when the tumor blocks the bile duct. Jaundice isn't a disease on its own, it's a symptom of something affecting the liver, gallbladder, or pancreas. In the case of pancreatic cancer, the tumor grows near the head of the pancreas, right where the bile duct passes. When the tumor presses against or blocks the bile duct, bile can't flow normally into the intestine. This causes bile to back up into the bloodstream, and that's when bilirubin levels start to rise. This causes a buildup of bilirubin, turning your skin and eyes yellow. Bilirubin is a yellow pigment found in bile. Under normal conditions, it's processed by the liver and eliminated in stool. But with the duct blocked, bilirubin starts accumulating in your body, and that's what causes the yellow discoloration. This yellowing first appears in the whites of the eyes, then the skin, especially under natural light. This visual change is often noticed by family or friends before the person realizes it themselves. Even your urine may appear dark, and stools may look pale. These are additional signs that bilirubin isn't being excreted properly. Dark urine, with excess bilirubin in the bloodstream, your kidneys try to flush it out, darkening the color. Pale or clay-colored stools, since bile isn't reaching the intestines, it can't give stool its normal brown color. These changes are not just odd, they're powerful signals that something is seriously wrong with your bile flow and possibly your pancreas. It's alarming, but it's also a critical warning sign. This line balances urgency with clarity. Yes, it's frightening to see your skin or eyes turning yellow, but rather than panic, take it as a clear message from your body. Jaundice caused by pancreatic cancer often means the tumor has grown large enough to interfere with other systems. That makes early action even more crucial. This bold opening makes it simple and direct. The pancreas plays a critical role in digestion by producing enzymes that help break down fats, carbohydrates, and proteins. When a tumor grows in or near the pancreas, it can interfere with these enzyme functions. As a result, food isn't digested properly, leading to a cascade of uncomfortable digestive symptoms. People often experience nausea, bloating, and even vomiting after meals. Here's what happens. Without enough digestive enzymes, food sits undigested in the stomach or intestines, creating a feeling of fullness, gas, and discomfort. Nausea occurs because your body is struggling to process what you've eaten. Bloating results from gas buildup during poor digestion. In more severe cases, the discomfort leads to vomiting, especially after fatty meals. These symptoms may mimic indigestion or food sensitivity, which is why many ignore them at first. Your pancreas helps break down fats. When it's not working properly, you can feel full quickly or lose your appetite altogether. This is crucial. Fat digestion is heavily dependent on pancreatic enzymes, especially lipase. If fat isn't broken down properly, it can sit in the digestive tract longer, triggering a false sense of fullness. Over time, this causes people to eat less and lose weight, even without trying. The loss of appetite isn't from food aversion, it's from your body signaling that it can't handle meals. Appetite changes without a clear cause? Pay attention. This line serves as a gentle but urgent warning. If you're suddenly eating less, skipping meals, or finding that your favorite foods no longer appeal to you and there's no clear reason like stress or illness, it may be time to dig deeper. These kinds of unexplained changes can point toward an issue with pancreatic function or even a developing tumor. New-onset diabetes. Surprisingly, some people first discover they have pancreatic cancer after being diagnosed with diabetes. That's because a tumor in the pancreas can disrupt insulin production. If you've suddenly developed type 2 diabetes, especially after age 50, with no family history, it's worth further investigation. This symptom may come as a surprise, but it's a serious one. Blood clots that form unexpectedly and in unusual areas of the body can be early warning signs of pancreatic cancer, often showing up before any digestive symptoms appear. Blood clots can sometimes be the first clue something's wrong. This line sets the stage. For many patients, a sudden clot is the first outward sign that their body is fighting something much deeper. Unlike typical risk factors for clots, like recent surgery, prolonged sitting, or trauma, these clots appear out of nowhere, a sign that a hidden medical condition could be to blame. Pancreatic tumors can trigger clotting in the legs, arms, or even lungs, a condition known as Trousseau's syndrome. This is where it gets specific. Trousseau's syndrome is a condition where malignancies, especially pancreatic cancer, increase the body's tendency to form clots. This happens because the tumor releases chemicals that interfere with normal blood clotting, essentially making your blood stickier. Clots might form in the legs, deep vein thrombosis or DVT, arms, lungs, pulmonary embolism, which can be life-threatening. Even a small clot in these areas can signal a larger, hidden problem. Sudden swelling, pain, or redness. Don't ignore it. These are the classic signs of a blood clot. Swelling, often in just one limb. Pain or tenderness, even without injury. Redness or warmth in the affected area. If you feel any of these symptoms, and especially if you haven't done anything to injure yourself or sit for long periods, it's vital to seek medical help immediately. Why it matters. Many people chalk up swelling or pain in the leg to a pulled muscle or strain. But when a pancreatic tumor is silently at work, this seemingly unrelated symptom could be the only clue your body is giving. Early detection of pancreatic cancer is rare, and blood clots might be one of the few early signs that help doctors catch it in time. Fatigue and weakness. Extreme tiredness isn't always just getting older. Persistent fatigue, even after resting, can be caused by the cancer draining your body's energy and resources. If you feel like you're running on empty day after day, it's time to dig deeper. Itchy skin. Before jaundice becomes visible, you might notice intense itching. This happens when bile salts build up under the skin, a sign your bile ducts might be blocked. Itchy skin with no rash or allergic reason. It's worth noting. Changes in stool. Oily, floating, or foul-smelling stools could be a sign your body isn't digesting fats properly. This is called stearia, and it often happens when the pancreas isn't producing enough enzymes. It's uncomfortable but also a powerful clue. Nausea after fatty meals. The pancreas plays a major role in digesting fats. When it's compromised, fatty meals can make you feel sick, bloated, or even trigger vomiting. If you're avoiding rich foods because of discomfort, there may be a deeper issue. Depression and mood swings. Emotional health is often overlooked. But studies show pancreatic cancer can lead to sudden depression, anxiety, or mood changes even before diagnosis. If your mood has shifted and there's no clear reason, don't dismiss it as just stress. At first glance, it might feel like a simple digestive issue or something you ate. But persistent bloating, especially when accompanied by other symptoms, can be a subtle but serious red flag. Pancreatic tumors can cause a buildup of fluids in the abdomen. Here's what's happening inside the body. As pancreatic tumors grow, they can cause fluid accumulation in the abdominal cavity. This condition is called ascites. The buildup may not be obvious at first, but over time, your belly begins to swell, not from fat or food, but from fluid pressure. This can happen without major changes in your diet or routine, making it easy to overlook. Making your belly feel tight or swollen. Many people describe this symptom as a feeling of fullness or tightness, like the stomach is stretched or distended. Pressure in the midsection even if you haven't eaten. Clothes that used to fit feeling snug or uncomfortable around the waist. It's not just discomfort, it's a signal that something deeper could be affecting your internal organs. Clothing may fit tighter, and you may feel full even after small meals. This is where the symptom can start disrupting daily life. You might begin eating less, not because of a lack of appetite, but because your abdomen feels stuffed after just a few bites. Even simple meals can lead to discomfort or nausea. Over time, this can lead to nutritional deficiencies and unintended weight loss, both of which worsen your overall health. Why it matters. Bloating is one of the most overlooked early symptoms of pancreatic cancer because it mimics everyday digestion issues. But when the bloating is persistent, unexplained, or paired with other symptoms, like weight loss or abdominal pain, it's time to take it seriously. Doctors can use imaging scans or fluid tests to identify whether the swelling is related to fluid buildup from cancer or another condition. Sudden back pain when lying down. Some pancreatic cancers press against nerves when you lie on your back, causing sharp or aching pain. If you notice your pain gets worse when lying flat, this could be a sign. Pale or greasy stools. In addition to floating, stools may appear clay-colored or greasy. This is a sign your bile isn't reaching your intestines again, pointing to a potential bile duct blockage. Trouble swallowing or eating. Advanced pancreatic cancer may lead to difficulty swallowing, a feeling of fullness or discomfort in the throat. If eating feels like a chore lately, it's time to speak up. Enlarged gallbladder or liver, detected in scan. Sometimes, a routine scan or ultrasound will show an enlarged gallbladder or liver, often due to a tumor obstructing the bile duct. These findings can be an early internal signal, even before outward symptoms show. High blood sugar without diabetes. Even if you're not diagnosed with diabetes, high blood sugar readings might pop up. This is often tied to early dysfunction in the pancreas and could be the first metabolic warning. Subscribe for life-saving health alerts. Quick reminder, if you haven't yet, please click that subscribe button and hit the bell icon. Every week, we bring you crucial updates on how to fight disease with food, identify dangerous symptoms early, and take charge of your health before it's too late. Don't miss a single video that could protect your life or your loved ones. Pancreatic cancer may be silent, but you don't have to be. If you recognize any of these symptoms, talk to your doctor. Early detection is your best weapon, and staying informed is your first step. Share this video with someone over 50. You might just save a life. If you found this video helpful, give it a thumbs up, and leave a comment with your thoughts or questions below. And remember, stay aware, stay healthy, and I'll see you in the next one.